international health program that is observed on the 24th of March every year. And the purpose is to create awareness about an airborne infection called tuberculosis that is caused by a Mycobacterium tuberculosis, a bacterium that is airborne. Everybody can get it. Anyone that can breathe in air into his nostrils, into his lungs, is vulnerable to the disease, tuberculosis. And tuberculosis is responsible for a lot of morbidity and mortality in our environment. The signs are that the person will be coughing, continuously coughing for over 2 weeks to 1 month and above, will be coughing. And with time, this cough will be mixed with blood, will be coughing out blood. And at the same time, the person will be having sweating in the night. He will sweat a lot. And also he will be losing weight. Drastic coughing, always sweating in the night. To suspect that the person is infected with TB. It's a TB patient, and it needs to be encouraged to go to a health facility to properly assess his condition, so that treatment very easily is commenced and will get well. And also screen the contacts. The people should also be screened for TB, so that if they are also infected, they should commence treatment almost immediately. Okay. If not, the case will begin to worsen and it becomes difficult to treat. Thank you very much.
All right. Looking at tuberculosis data, the Federal Ministry of Health and Social Welfare says over 400 TB cases were recorded last year, which is 2024, alone, despite the diseases being preventable and curable, as you have affirmed. Yes. It says it remains a leading cause of illnesses and deaths due to low awareness, delayed diagnosis, and barriers to treatment access. Also, the latest report released by the WHO, that report was released last year, October, and it shows that over 10 million people from 215 countries, including Nigeria, were infected with the diseases from 2023 to 2024. And a good number of these cases were said to be living with other diseases like HIV and AIDS. So, looking at the theme for this year, which is yes, we can end TB, commit, invest, deliver, to what extent is the commitment to ending TB, especially now that other donor agencies like the US have said we are no longer funding some of these courses in other countries?
Thank you very much. The figures you have quoted are all very correct. Yeah, Nigeria. In fact, Nigeria is the leading. It has the highest burden of tuberculosis in Africa. Nigeria has the highest burden of tuberculosis in Africa, and the tuberculosis is a leading cause of death in Nigeria. So this year's theme, which says, yes, we can end tuberculosis, commit, invest, and deliver, is very, very apt. We need to be committed to the cause of ending tuberculosis. As a nation, we really need to commit ourselves, commit resources. Even the communities need to be committed to ending tuberculosis. It is true, you have mentioned it, that hitherto Nigeria have been helped with drugs and diagnostics from America, from Germany, for diagnosis and treatment of tuberculosis. And recently, when Mr. Trump became became president of America, he did say that he's going to suspend some help, some funding to some certain diseases in Africa. And this is because he knows that Africa has the capacity to take care of their citizens, especially Nigeria. We have the capacity to take care of all TB cases, all HIV cases. In fact, every case that is ravaging our nation, Nigeria has the capacity, has the ability to take care of it, if only we can be committed. The only thing is that we have over-relied on the donor agencies, USAID, Global Fund, and the rest of them. Nigeria has over-relied on them, and these people have only come to help us. They have not come to take over our responsibility of taking care of our communities as a nation. So treating tuberculosis is not impossible for Nigeria. In fact, it's very, very easy. With the resources that we have, both natural resources, capital resources, human resources that we have, we can take care of treatment of tuberculosis. Nigeria has the wherewithal to do that. It's just that we don't have enough political commitment. But if only we can commit a little of our resources to diagnosing tuberculosis and treating it, it can be done. And that's the theme for this year. We just need to show some more commitment. We need to invest more of our resources on treating tuberculosis, treating HIV, treating malaria and other diseases that is disturbing our citizens. And if we are able to do this, we can deliver a very good health system to our community. Thank you.
Returning to the diseases,
yes,
because our focus is more on the awareness to people, because
yes,
the WHO also says that, or the Ministry of Health and Social Welfare also says that basically the disease is thriving in our communities because of lack of awareness. So that is why we've put this program together to make people understand, how to go about if they are infected or how to prevent it. So, to this light, what are the causes and symptoms of tuberculosis and how it is? Is it diagnosed?
Okay, I already mentioned it in my opening speech that tuberculosis is an airborne disease that is caused by a bacterium called Mycobacterium tuberculosis. That is the main organism that causes tuberculosis, and that is a species. The particular species is a MTB, the Mycobacterium tuberculosis. There are some other strains, other species of mycobacteria that cause tuberculosis, like Mycobacterium bovis, Mycobacterium ulcerans, Mycobacterium avium, and others. But this one causes tuberculosis in people that have some other comorbidities, like diabetes, like HIV, or cancer. They are the people that can come down with Mycobacterium ulcerans or avium. But the classical species that causes tuberculosis is that of Mycobacterium tuberculosis. And the symptoms are that the person will be coughing. That coughing must be there. They will cough.
Doctor, let me interrupt you before we go to the symptoms. All sometimes when these names are mentioned, like mycobacterium, they sound technical to us.
Okay.
But we know that when you expose yourself to cold, for instance, you are going to, come down with fever or something like that. The practical. Let's step away from this mycobacterium and let's be more practical. What are the kind of things that I do that I'm exposing myself to tuberculosis?
Okay, like I told you earlier, everyone is the MTB. People cough when this sputum or spittle, the dust. Environment as you are breathing in dust are exposed. So it's not about whether you are in a cold or anything like that, everyone is exposed.
Okay.
Every single person that breathes in oxygen, that breathes in air, is exposed. And the only thing that we need to do to prevent it, or maybe I'll be coming to that later, is to have clean environment and to form clean thing. Don't throw out the spittoon everywhere. If possible, you can spit into your handkerchief, into clothes that you have with you, so that when you get back home, you go and boil it and wash it and decontaminate it and continue to use it. But coughing or sneezing, throwing catarrh, spewed everywhere in the environment exposes everybody in the community to tuberculosis. So that is how it is carried about. As wind is blowing about, carrying the dust, is carrying it along with this tuberculosis bacillus. And anyone that is breathing in is breathing these things in and is susceptible to the bacillus.
Okay, so let's look at the signs and symptoms.
Okay, the signs and symptoms are that the person will definitely be coughing for a prolonged period. You'll be coughing, non-stop, taking other things. It does not stop the coughing. And at the same time, fever is accompanied with the coughing. The person will be having fever. He'll be having high temperature. They will be sweating a lot in the night sweats. And added to that, the person will be losing weight drastically. When you see the person, you know that he's actually sick. And this sputum later on will be mixed with blood. As he coughs out, brings out the sputum with blood. Those are the symptoms of tuberculosis.
And in terms of diagnosis?
Okay, for diagnosis, you cannot just look at somebody and say because he's losing weight, because he's coughing and all that, he has TB. You definitely have to present yourself to a health facility. Even if it is primary health care that is closest to you, go there and complain to the health professional, to the health officer there, either the CHU, the nurse, the doctor, or the people that are working in the hospital. You go and complain to them, they take your history, and then they will do a simple test for you. This test is called AFB, acid fast bacilli. You'll be requested to produce a sputum at the spot, and then they will give you another container that you go home early in the morning. You go to an airy place and make a deep cough and put the whole thing inside the container that they will give to you and present it to them in the laboratory. These specimens will be collected and analyzed via what is called AFB or the nursing stain, and then they will be able to know tuberculosis. But these days, we have more improved technique that is called the gene expert. The gene expert is a miniature molecular technique. It's a miniature PCR, polymerase chain reaction technique. It's very effective, very conclusive in the diagnosis. You submit your sputum to the laboratory, and then they will analyze it with the gene expert machine, and then they will come out with a diagnosis whether you have tuberculosis or you don't have tuberculosis. And the additional advantage of using the gene expert machine is that it will also tell you whether the first line drug called rifampicin that is used to treat tuberculosis will be active to treat this tuberculosis or not. So it has that added advantage. It can detect the MTB. It can also detect whether rifampicin is whether the MTB is already resistant to rifampicin, and then from there the doctor can carry on from there to manage the patient.
All right. So we've talked about the prevalent rate in Nigeria. So I'd like us to bring it back home in Benue State.
Okay.
What is the prevalent rate of tuberculosis in our state?
Well, this has to go back to research. Somebody has to go to the field to assess those who are coughing, and they carry out the tests and all that on the population of Benue State to be able to know the prevalence or the incidence, that is the current infections that's on ground. I don't have access to that record right now, but I work in a hospital and I see a lot of people who are, I see the positive cases. The positive cases for MTB is quite high in Benue. It's quite high in spite of the fact that it's a preventable and treatable disease. But I don't have the exact figure to give you that the incidence or the prevalence of MTB in Benue is 20%, 30%. I don't have that right here to give you now, unless I have to get back to some records that are available, and then I can do that.
Okay, we started talking about the risk factors, but now is the opportunity to highlight probably more of them and how they can be mitigated, so that tuberculosis doesn't get to spread as wildfire.
Okay, thank you very much. Available record that is there says that 20% of tuberculosis cases are caused by malnutrition. Malnutrition, people not eating properly, not eating good food, people not even having access to food. Malnutrition will cause your immunity to drop. And when your immunity is dropped and you come in contact with the mycobacterium tuberculosis, you'll be infected. How is this malnutrition coming about? We know what we are going through right now. A lot of people are homeless. A lot of people are living in IDP camps. We will farm crops, but we will not be able to harvest them. And so access to food security is very, very low right now. So people that are malnourished are easily susceptible to tuberculosis, because like I told you, everyone that is breathing in oxygen is vulnerable to tuberculosis. But if your immunity is high, if your defense system is high, you will come in contact with MTB bacillus, but you will not be infected because your defense system is strong enough to deflate, to remove it from your body. So there is need for us to feed properly. And when I say feed properly, it's not about taking a whole bowl of akpu or eba or pounded yam. What goes with it is very, very important. The soup, the protein component of the food is very, very important. We grow rice, we grow yam here, we have access to this starchy food, but make sure it is mixed with enough protein. Vegetables, fruits, and meat. These are the things that bring in the protein, and is a protein that helps you to build your immunity. So we need to feed properly, and also we hear that 10% of the figures are also attributable to HIV. We have high incidence of HIV in Benue State. If you have HIV, definitely what HIV does to you is to lower your immunity. It destroys your CD4 cells that builds immunity. And so if you abstain from illicit sex, from unsafe sex, and keep yourself pure, keep yourself safe from these STDs, you'll be less affected by tuberculosis. And also 3%, they said, is attributable to diabetes mellitus. If you also have those who have diabetes, they are also known to have low immunity. So anything at all that causes immunity to drop will expose you to tuberculosis. So if you have diabetes, make sure you treat it always, and then you try to maintain your health by taking a little exercise every morning, or every other day, and taking your drugs from time to time. That way, you'll be able to live with the diabetes very well, and it's at every evening you go out, and some of these, but they expose themselves to have lowered immunity. So it's good to control your intake of alcohol. Control your intake of alcohol so that you will not be so exposed to this bacillus that we are talking about. And then the environment that we live in, we should try to clean our environment as much as possible. I know that every last Saturday of every month we engage on environmental sanitation. We clean our gutters, clear the grasses around us, and clean the environment completely. If you are living in a very clean environment, you'll be less susceptible to tuberculosis. So we need to live in neat environment and stay away from dusty area, because this dust that is all around us are laden with tuberculosis, bacillus. Thank you.
Okay, if you're just joining us, this is Agate Radio 95.5 Star FM Makurdi. The program is Perspectives, and our focus is on the World Tuberculosis Day. The guest with us in the studio is the Benue State Chairman, Association of Medical Laboratory Scientists of Nigeria, Dr. Paul Abba. So, Doctor, you were talking about the risk factors, and then I also want to ask you if it is possible to infect someone with tuberculosis spiritually.
Spiritually, no.
Okay.
Tuberculosis, our people, they ascribe many things to spiritual problem. Some of them will tell you that this tuberculosis I'm suffering was sent to me from the village by my enemies that do not want me to progress. They sent it to me. They afflicted me spiritually with tuberculosis, but that's not true. That's not true. Tuberculosis, like I said, is airborne and is contracted by contact. If you are in contact with somebody that is infected, that is suffering from tuberculosis, you are likely going to be infected, because as he breathes, as he sneezes, as he coughs, he expels out millions of the bacilli of tuberculosis. So it's not infected. It cannot be infected by spiritual means, please. Thank you.
So now we want to look at the role vaccines play, because at some point we understand that there are vaccines to that regard. So what role do these vaccines play?
Thank you very much. That is one key way. Vaccination is one key way of preventing tuberculosis. And it's one of the vaccines, one of the immunizations that they give to children at birth. The BCG, the vaccine or the immunization is called BCG. And children are the weakened form of the bacillus, of the tobacco bacillus. It's the weakened form, and when it is introduced into the body of the baby, it will elicit the production of the antibodies against this bacterium, against this germ, so that it will produce enough antibody to counteract those tuberculosis germs that will come in contact with him. So it is very, very important. And some people are negligent about it. Some parents are negligent about it. Say, no, I don't want vaccination. I don't want BCG for my child, because when they give, their body used to be very hot. Their body will swell up. They'll be having fever. They'll be crying, this is and that. No, let that not discourage you from exposing your child for vaccination. It's very important. All children should be vaccinated. All children should be vaccinated against tuberculosis, and that will fortify them against the disease. Thank you.
Okay, when you say children, what age bracket are we looking at?
it's at infancy. Well, I think it's, the doctor is here. I want to welcome my doctor.
Okay.
Good morning.
It's as soon as the child is born.
Okay,
I
I
think
wanted
the
you-
following day.
I wanted you to
goes.
round
Let
up
the
before-
doctor give more insights on that vaccination. Thank you.
I wanted you to round off before I would introduce the doctor. And then, by the way, he's a resident doctor, Department of Epidemiology and
Yeah.
Community Health at the Benue State University Teaching Hospital, Makudi. And he is Dr. Nso Ansa. And thank you very much, doctor, for joining us.
Thank you very much. Good morning. Good morning, sir.
Doctor, you're welcome.
Thank you.
All right, so Dr. Abba had already called you in. So let's look at the age bracket of the children to be vaccinated against tuberculosis.
Yes, okay. So BCG is given at birth.
Okay.
Yes, if there's no reason not to give it at birth, it's given at birth. Yes, it's part of the National Program on Immunization, and it contains, the National Program on Immunization has a number of vaccines against killer diseases that are childhood killer diseases. So these vaccines exist, and then they have at what ages they should be given, what doses, and so on. Indication, no known reason why the child should not be given the vaccine. Should be given the vaccine at birth, preferably within the first 2 weeks of life.
Okay, so how accessible are these vaccinations?
Okay, well, the BCG happens to be fairly accessible. It's accessible at the private healthcare centers, virtually anywhere they give vaccinations. By the time usually when pregnant women register for antenatal care, they are told all those things. You know, they are given health talks that include how they should vaccinate their babies, and usually almost every from the primary healthcare center to secondary to tertiary, anywhere they do vaccinations, the BCG is given. It's fairly common. Women of reproductive age who have had at least a child, I'm sure almost all of them know where they can get their children vaccinated for tuberculosis. It's a very common vaccine. They may not know for sure that it is, if you meet a mother and say, where can you get BCG, or so they may not be sure. But if you say, has your child been vaccinated against tuberculosis, or is there a place where you have been taking your child for vaccination? They definitely have a place where they've been vaccinating their children.
Okay, so you mentioned the national policy. So does it mean it's free of charge, or it goes with a cost?
It's given free of charge. All the vaccinations, all the vaccines that are on that NPI schedule are given free of charge to the mothers. Of course, somebody is paying for them elsewhere, but at the point of consumption, they are given free of charge.
Oh, that's awesome. All right, so now we want to look at the economic and social impacts of tuberculosis on individuals and communities. And I'd like you, Doctor, to just joining us to individuals and then the communities that we live in.
Well, there are quite a number. Some of them are specific, others are not social and economic impact of ill health generally on the population. On the individual, of course, there's the discomfort that comes with being sick. For people who, maybe have not commenced treatment early, who have not been diagnosed early, it can be quite troubling. If it's pulmonary tuberculosis, that's the one affecting the lungs, there is this persistent to me also as a person socially, and then even to the people who are around me. So there is a discomfort. Then there is a loss of productive time, productive hour. They are sick, they may be bedridden, they may not be bedridden, but they are uncomfortable, they are not able to work effectively, they may not be able to come to work if they are employed, they may not be able to go to the farm or do some of their personal activities. So there is a loss of otherwise economically productive hours. Then there is also costs. The individual incurs costs when they begin to seek treatment, especially in a setting where people go to chemists and several other places. Because I'm saying that because treatment for tuberculosis is free. There are programs that provide treatment for tuberculosis free of charge to the individual. But if the individual goes from place to place seeking care, they may do that at their own expense. Then if you look at the cost to the society, I mentioned the individual. If the individual is a student, there will be a high absenteeism from school, illness on activity in that community or the locality. There may be breadwinners, there may be costs, and then increased power, and then you have to have bed and so on. So it puts pressure. The treatment comes to us, to the end user, free of charge, but there's a lot of funding that goes in, every day for that to happen. So it has quite a number of interrelated consequences, both on the individual and on the society.
Over to you, Dr. Abba. We want to look at, because one of the issues that I read about is the issue of stigma.
Yeah.
Yes, people with these diseases are stigmatized. So we want to look at how to reduce the stigma associated with tuberculosis and encourage those affected to seek medical attention.
Thank you very much. Stigmatization is one main issue. You see, they look at people who are coughing and emaciating at the same time, losing weight, as some people that have some serious issues. Like you were talking the other time, jokingly, they look at them like maybe some evil spirits are eating them up. They are being eaten up by evil spirits, by Batsav or whatever. So they stay away from them. And then they are also aware, the community are aware that these people, they can spread the infection. They can spread the TB infection, so they keep them at bay. There is social distance from them. So it's a serious social problem, economic problem. And also they are discriminated against. Like you want to recruit employers for your company now, and you see somebody come coughing and looking so emaciated, you will not take him. You will not take him. They are discriminated against. So it's a serious problem. And as the doctor has very well spoken about, that when somebody is down with this disease, he becomes very weak. He cannot attend to his responsibilities. He can't fend for his family. He cannot go to the farm. He cannot do all those things. If he's a bike rider before, he doesn't have the energy to do biking again. So the means for daily income is cut off, and it's very, very serious. So what we need to do is to create more awareness about this disease, that it's not spiritual. Yes, it is infectious, it's contagious, but everyone is vulnerable to it. So you don't need to discriminate, to stigmatize them. You need to show understanding with them and help them to get treated and get well so that they can be integrated back into the society. So what we need mostly now is awareness. It's awareness that TB, running away from the victims of TB. Thank you.
Dr. Ansah, so Dr. Abba emphasized figures I saw and also the things I read. So now, coming to the side of awareness, what more do you think should be done in that regard?
Well, it's to sustain the tempo of awareness creation and to cascade it particularly down to the grassroots. Part of it is what we are doing here. I'm sure that Agate has quite a wide coverage, and by the time people start calling in, you are going to see people calling in from the rural communities. They are going to have access to this information, and when we do that, when we increase the tempo of awareness creation, it also helps in aids in case finding, because individuals who maybe they have a neighbor who has been coughing, who has been losing weight, and so on around them, but because they didn't really quite have this information, they don't know what exactly is happening with the neighbor. They may be thinking it's something else, like Dr. Abba has said, but now that they have access to this information, they'll say, oh, this sounds like what I heard on the radio earlier today, that it might be tuberculosis. Have you gone for a test? Have you gone for a test? And so that can lead to increased case finding. Some of the ways to increase this awareness, apart from leveraging on media platforms like your radio station, is to design and print posters. If you go to primary healthcare centers, you see posters designed. Some of them are cartoons designed in the local dialects that are prevalently spoken in those communities. So people know to just have simple messages. If you have somebody who's coughing for this duration, who is losing weight, who has fever, and so on, and so on, then you should present to this facility or call these numbers, and so on. So those things continue to increase the awareness. They can also be radio jingles. Jingles can be produced, aired on radio, on television. Today we have the social media. Anywhere the internet gets to, this internet penetration, people can receive messages. They can have that on Facebook, on Twitter, and so on. So we can leverage on that awareness creation, because it helps to. One of the challenges with this issue is case finding. It, like you said, it is treatable and curable. It's a treatable and curable condition. But the question is, how can we get everybody who has active tuberculosis identified on time, treated and cured, so that they recover themselves and also minimize the risk of transmission to others?
Okay, I had already asked Dr. Abba this question, but I want to ask you too. Now that we are having the issue of funding, some persons have caught away that we're no longer funding. So what do you think the government of Nigeria and the various state governments across the country should do in order to sustain the funding? Because the issue of child malnutrition, I read that UNICEF were complaining the other day that by the end of this month, they may no longer have the resources to take care of malnourished children because of the cut in funding. So how do you think this is going to affect tuberculosis treatment?
Well, it's sad. It's quite sad that the United States is reviewing its funding of the United States Agency for International Development. And the consequence of that for not just Nigeria, but Africa and other low and middle income countries is quite tremendous. Well, it creates vacancy, it creates a vacuum, and that naturally falls to the various national governments and sub-national governments to step in to fill up that vacancy. How they can do that is a matter of policy. I think we have to deploy ways to better utilize our resources, better allocation, and better utilization of our resources. And then it has quite tremendous impact even on tuberculosis, and these are related because you probably must have talked about TB, HIV co-infection. That funding, the cut in funding is affecting HIV treatment programs across the world also. And tuberculosis is one of the leading opportunistic infections in persons who have HIV, and the mortality is higher in that subgroup. So it's related. Malnutrition, immunosuppression, that people who have their immune system not being optimally functional, either because of a disease or other conditions like malnutrition, is also a risk factor for contracting tuberculosis. So you see, we are talking about malnutrition, cutting funding for malnutrition is going to make a larger population of individuals, of children, predisposed to contracting tuberculosis, and then when they contract tuberculosis, the funding for treatment also becomes limited. So it's really a network of challenges, and we hope that African governments will step up promptly, both to raise more resources and then to ensure, importantly, prudent utilization of resources, because there's not going to be free lunch forever, even in Freetown.
Thank you very much. So African governments should sit up.
Yes.
So that, because Dr. Abbas said we have the wherewithal, that
I agree.
We have everything.
I agree.
It's just to use it properly.
Yes.
Okay, so we are looking at, by the way, let me remind our listeners that by 10 o'clock I'm going to turn on the studio line so that they can start calling in to contribute. But the line for SMS and WhatsApp text is still on 091-2699-9404. So if you have a text or WhatsApp message, you could send to that number already. It's already on. Okay, so now we're looking at how to improve access to tuberculosis diagnosis, treatment, and care, especially in rural and underserved communities. because sometimes these things are best done in cities, in towns, but when you go to the villages where you walk kilometers to access even a primary health care, so what become the faith of those people living in that area? So I want you, Dr. Abba, to take on this.
Thank you very much. We have just agreed that if tuberculosis is detected on time and is treated, it will be cured. So the first port of call is these PHCs, primary health care centers. And in every local government, we have enough PHCs. The only issue is that some of them are not being manned by health professionals. They are not being manned by enough health professionals. So it's now the responsibility of our government of the day to make sure that these primary health cares, moribund primary health care in the local government areas are brought up. They are brought up, the equipment are updated, the facilities are updated with equipment and with personnel. And especially what I observe in Benue State right now is that most of the primary health care centers, they have no facility for laboratory diagnosis. When you go there and you even see a lab at all, there will be no lab technician there to carry out this simple diagnosis of tuberculosis, which is done by AFB, staining. AFB staining, nursing staining. The facilities for this are not there. The personnel are not there. You know, all you need is a microscope, light, and then the stain and the personnel. If these are in place, if somebody is coughing even in the remotest part of the state that have a PHC and is able to get to the clinic and produce a sputum, it can be diagnosed by a technician, a medical laboratory technician, and the drugs till now to life, to health. So we are calling on the government of the day to please renovate the primary health care centers and employ health professionals, MLT, nurses, health care centers. The truth must be told. You don't have enough doctors to man every primary health care. But in every local government to supervise the PHC condition that are identified. And also reporting. Reporting is very, very important. As the cases of the tuberculosis are being detected, they should be reported immediately. Because one unreported case of TB will result to infecting about 15 people in the community. So it's very, very key that as the cases are being detected, as the cases are being found, they should be reported immediately so that they drop.
All right, thank you very much. Dr. Anzai, you may wish to add to that.
Well, the thing is that it's TB preventive and diagnostic and curative services are actually there are some higher diagnostic, you mentioned staining, which can be done at that level with us for a while. You are talking about microscopy, then you're also, apart from the manpower that he mentioned, you're going to have to talk about power supply, electricity. Right. You're going to have to talk about electricity. So what is happening in some places is the use of solar. You know, we have a lot of sun here. So people are leveraging on solar source of energy to generate electricity for these facilities. And I think that there are a few pilot primary healthcare centers, even in Benue, that have these solar panels established. So we hope that these processes will be accelerated, and then these primary healthcare centers will improve their ability to diagnose and promptly diagnose tuberculosis. Because quite frankly, by the time you have somebody coughing in, let's say, Vandika, for instance, and he has to come all the way to Makudi to give sample for GeneXpert and so on, the cost of transportation alone can be quite prohibitive. But in his ward, because the primary healthcare centers are distributed on the basis of the wards. So you can see at most within his ward headquarters, there will definitely be one that he can get to, can go there in the morning and come back and even go to his farm. So if we make the primary healthcare centers functional and we build basic capacity at that level, it will go a long way in case finding, diagnosis, and even treatment of tuberculosis.
Okay, we did talk about vaccine in children and all that. So now we want to look at if there are any challenges associated with diagnosis in children, and then diagnosis and treatment of tuberculosis in children and pregnant women in the various underserved communities. Are they even willing to come out, even if the facilities are there? That's another thing, Dr. Ansah.
Okay, well, when you say underserved communities, they can be access to these services is below the average. Below the average. There can be a number of reasons why they are underserved. They can be mountainous areas or places that are separated by rivers across which there are no bridges or issues of access. There may be places that are in crisis zones. There may be internally displaced persons. So the challenge there is basically the challenge of access. How can these communities be accessed, or how can these people living in these communities access services where they are available? Apart from that, the other challenges that exist in diagnosis are the ones we have talked about: availability of the testing modalities, the equipment, then availability of trained manpower to handle those equipment, and then accessibility of this equipment to these communities. Decentralization of these services. So underserved communities that and so on, those or even criminalization are challenges. So the underserved communities are basically communities that are cut off from the rest of services, access to services, due to how difficult it is to reach them. May that become
that attending to calls. You're welcome back. You're still listening to Perspectives on Agit Radio 95.5 Star FM Makudi, and we're looking at our focus today is on the World Tuberculosis Day, and I'm being joined in the studio by two professional health professionals. First, we are with the Benue State Chairman, Association of Medical Laboratory Scientists of Nigeria, Dr. Paul Abba, and a resident doctor, Department of Epidemiology and Community Health at the Benue State University Teaching Hospital, Makudi, Dr. Sonda Ansah. All right, the number for you to call to be a part of the program is 0814-335-9292. That is 0814-335-9292. Alternatively, you can reach us via text and WhatsApp messages 0912-699-9404. Hello, good morning.
Hello, good morning.
They are listening.
I am Sekula Haje from Batia, Boko local government.
Okay.
Thank you so much. You are discussing tuberculosis. I heard very well, and it's very clear to me. It get a time back, one of my brother was in Boko, and he's a victim of TB. And imagine that question you ask the doctor there, that the tuberculosis can affect people through spiritual. He says no. And the man, my brother from Boko, says it was spiritual. And he is worried very well because of villagers that done that to him. In fact, I need everybody in Nigeria to be hearing Agate Radio. Very good news.
All right.
And it's very clear. So I want to appreciate you people and the guests with you in the studio. Thank you so much.
Thank you very much. But Tekula, before you go, I'd like to understand something from you. So, what the doctor said, do you believe that the tuberculosis was spiritual or wasn't spiritual?
I don't know. I'm complaining that my brother was saying he was spiritual.
So,
the doctor said,
but what did
no.
you say?
That is what's clear to me now.
Okay. Thank you very much.
I want to greet the doctor for that speech.
Thank you
so much.
Thank you, Mr. Tekula.
All right, thank you. Okay, so doctor has clarified that tuberculosis is not spiritual. You know, if you get diagnosed and you are well treated, it's gone without any spiritual attachment.
Exactly.
Hello?
Yeah, good morning.
Yes, good morning.
This is Zakaria from Berlin, where is local government.
Sorry, I didn't hear the surname.
Zakaria.
To.
S-U-E.
Okay.
Sue.
Yes, Zakaria from where is local government, Berlin, precisely.
Okay.
I want to appreciate the guests in the house for their wonderful explanation they have given to us. Most especially in the line of causes of tuberculosis. They give us a wonderful explanation there, which I was very, very clear for the explanation. I was once a victim of tuberculosis and I was treated in St. Vincent and Day. Most of my people were asking me to go and conduct the suicide so that we will treat it in, naturally or traditional.
Alternative medicine, yeah.
Good. But when I went to the St. Vincent there, they told me that I should not treat it in traditional. So I was treated just 3 months and I was signed that I am cured. So I was so happy, and having explained here now, I think that, or I come to understand that TB is not a spiritual disease, and the awareness should be created in our local places. Most of us in the villages, we don't know where to go and have good access to drugs and will be treated. Just one person that asked me to go there, and when I went there, the doctors even advised me to come back and spread the awareness to my people. Any person that is coughing should go there. But when I explained to some of people, they were not agree with what the doctor said. They said that this thing is caused through the spiritual or in a horn. They say it's a horn disease, colo. And it's good doctors for quick reaction for their TB. Thank you so much for your explanation.
Oh, thank you very much, Zakaria. And do have a great day.
Thank you so much.
You can also be a part of the program if you died 0814-335-9292 or send us a WhatsApp and text message on 0912 6999404. Hello.
Hello, good morning, my brother.
Yes, good morning.
Yes, I'm Peter Taylor. I'm calling from IBB Square.
Welcome.
Yeah, my colleague, Benue State. I want to appreciate you guys. I want to thank Agate Radio so much for this program. This is part of sensitizing the public concerning the issue of tuberculosis. When I was listening, I was laughing because how will you say that tuberculosis is being plagued by the spiritual? People should put off ignorance and face the reality of life. It's a very welcome one. That is why I deeply appreciate Agate Radio. The kind of sensitization. People should help other people who don't listen to radio. They should go and make a test to know what is their problem. Everything evil comes from the village. It's not like that. This is something that has to do with what? Infectious. It's an infectious kind of disease. And many people are suffering from it. But in one way or the other, many people are preventing them that you for prayer, go for prayer, someone has done it for you. Instead of telling the person to go to the right place, the hospital, to receive medical care. I know that prayers work, but you also have to go to the hospital for your medication. It's very, very important. So people should put off ignorance and stop all these things of evil.
All right. Okay.
Very true.
Peter,
Thank you so
you've
much.
made your point. Thank you very much
Thank you.
for being part of the
Thank you.
program.
Thank you.
All right. Prayer works. People should also be diagnosed to see that indeed they have the diseases or not. Hello.
Hello.
Good morning.
Good morning. Emeka from North Bank.
How okay?
Yes. I think TB is not spiritual. TB is a sickness that comes along one's way. And I do feel that everybody should go for medical checkup. Because by the time you go for checkup, you know really what is wrong with you. And I do believe that because people doesn't go for the village, they send that sickness to you. It is not true. These days now, when you look at what we eat, you look at how we live in our various homes. Some people are not keeping their environment clean. And these things causes a lot of problems in our families. So I believe that if you are going to the hospital for a proper checkup, you will dictate early on what has happened. And I thank God that people have come on the radio. But not only radio only can give us information. There is this going around. Maybe like those days when our people used to go from house to house. We go through our community leaders. We go through our chiefs. We go through our people who are within and talk to them. Through these things, we can get it right. And people will hear about TB. TB is all over. And people are ashamed to come that I'm having TB. You mean that I'm having TB? People will say I'm having TB. I think when we go out, information coming around, talking to people, town hall, meetings, and talking to the people, I think it will help us all. So I am calling on everybody, go to the hospital and do your checkup. Do tests, and you will know what is wrong with you. And that is the only way we can get it right. Thank you very much. Lord bless IGET Radio.
Thank you very much.
In the studio, and bless many people.
Thank you very much, Emeka. We do hope that you also, take the message, the good news to the people, encouraging them to go. Hello. 0814-335-9292. Hello.
Hello. Good morning.
Yes. Good morning.
Good morning. Yeah. Good morning, Mr. P. My name is Stefan S. calling from KN Town in northwest part of Nigeria this morning. Hello?
Yes, I'm with you.
Northwest.
Okay. To me, you see, TB has to be celebrated and awareness has to be created because this is a curable disease, but it's a very deadly, more than HIV. So to me, government should make this in such a way that people at the rural area, if we go to our rural area now, most of the facilities, you don't have TB doctors or TB awareness, but if they can make it, I think it will make a positive change. So government and traditional rulers, both at the state and local government, they should key in so that we can have access treatment. I think by that we'll have a better nation. Thank you and God bless you.
Thank you very much, Tifa Kirike, for being part of the program.
Thank you.
0814-335-9292.
Julian Tina by name.
All right, go ahead, Julian Tina. Where are you calling us from, by the way?
Kilometer 14, Bokoro Channel.
Okay.
Yes, it's about the discussion you are having this morning. Thank you very much. Because I'm having a brother that he was having the same issue. So as he was being treated to Federal Medical Center at Peace, and at the same time, after the treatment, although everything was fine, but later he become this thing. Maybe you talk half before you will have this. So what is the cause of that? That is why I'm confused.
Okay, so you're listening on so that the doctor can respond to it.
Okay.
Thank you.
Because the drugs were too high, or I don't know. But now, anytime you want to talk to him, maybe you tap him or you write something that he has it there. So definitely, I'm confused.
All right, we have professionals in the studio. They will attend to the question. Thank you.
Okay, thank you.
All right, Dr. Anza. So I think we should quickly respond to this one so we don't forget that.
Well, we know that the medications that we use, not just the ones we use in treating tuberculosis, but all medications have known and sometimes unknown side effects. Why we use them is because those side effects are known and the frequency at which they occur also is known, and there are mechanisms for handling them, treatment modalities, management modalities that are available for controlling and responding to these side effects. So I think that it's possible that he has had another side effect of of the drugs, but that's one possibility. Loss of hearing can also come from other sources, even in people who are not taking chronic medications use. So I don't know how long ago a doctor and you notice changes in your body, adverse changes in your body that you do not understand. The proper thing to do is to go back to the person who prescribed the medication so that they can review. They have the knowledge. They will be able to know whether it is what your experience is coming from the medications they are giving you, or it's even another complication of the disease itself, or it's just coincidence, a coincidental occurrence. So I think whatever the case, he should see a doctor, preferably where he was treated, but if not possible, go to the hospital, see a doctor, and you'll be evaluated properly and managed.
Okay, we hope that you are answered. 0814-335-9292. That's the number to call to be a part of the program. Also, you can send us a text or WhatsApp message on 091-269-99404 so that you could be a part of the program. Ask your questions or contribute as you can. All right. Hello. Hello. Hello.
Hello.
Yes. Good morning.
Morning.
What's your name and location?
My name is Efforts Frank, calling from Nigeria, Makodi.
Frank? I didn't get the other name, sorry.
Efforts.
Okay. Go ahead.
To first and foremost acknowledge that today happens to be World Tuberculosis Day. And your guest in the studio has dealt with this comprehensively. But I still look at it that we need more creative and passive information to reach the populace. And I also want to crave the indulgence that the government from national, as in from federal, state, and local, in the 3 senatorial districts, my request that the government should create a center for tuberculosis treatment in Zone A, B, and C, so that patients not necessarily coming to Makodi or looking for, I know places in Jos where people go to treat tuberculosis. And that kind of cost, if you have that kind of center in the state treatment, one of the reasons why people suffer tuberculosis, one is lack of centers for treatment. And if this is done, I think tuberculosis will be totally wiped out of Benin and Nigeria. Long live your guest in the house, the presenter, and I Get Radio, and long live Nigeria. Thank you.
Thank you very much. Doctor, okay. All right, so the line is still open, 0814-335-9292. Hello? Hello? Okay, maybe you can call us back. 0814-335-9292. Hello? Hello? Hello,
Good morning.
Yes, good morning.
Yes.
What's your name and location?
I must appreciate the topic of today. And the analysts have discussed the main on the topic. My contribution is there are primary things that government has to do for its people. Those are the things. So our government has to step up. They has to prioritize the health of the citizens. So they are to do a long way. They are trying, but they should keep up. Because if you come to rural areas, you discover people are affected with this disease and they have nowhere to go. So government has to create awareness, medications, and the rest of it. We will be glad if government do it for us. Thank you very much.
Thank you, Takuru Kuanyamazinga, for your contribution. 0814-335-9292 is the number to call and be a part of the program. Hello? Hello?
Hello, good morning.
Yes, good morning.
Thank you. My name is Jude. I'm calling from Bakuma.
Okay, go ahead.
You see, TB, your analysts or doctors in the house have done justice to the topic. But I still want to call on the government to do more. Equip our primary health care center to handle cases like this and other related diseases that are disturbing people or the masses, especially in the rural areas. If the government can equip our primary health care center, equip with drugs, good health personnel that can handle such cases, I think the menace will come down. And enlightenment is very, very important. Sensitization is very, very important, especially in the rural areas. If you are coughing for more than 3 weeks, I think you should go to the hospital or a clinic or a primary health care center in your locality to know or ascertain the type of cough you are having. Thank you and good morning.
Thank you very much for your contribution. And let's state that TB treatment is said to be free across the state. We did a report yesterday where we spoke with the person in charge of. Okay. Hello.
Hello. Good morning once again.
Yes. Good morning.
I'm Tenayodan by name.
Okay. You asked a question.
Yes, I want to appreciate the answer you've given to me because I personally was a victim and my eldest brother. So according to what I discovered, he did not follow the instructions given to him by the doctor. So like to my own side, I personally followed the instructions and maybe I used only 4 months in the hospital, which I was discharged. And since 2018 till now, nothing has happened to me. I've never experienced such a thing again. So I want him to understand that it's not spiritual or anything that is causing people. At least he should put faith and give grace to God because he did not follow the instructions.
All right.
So the answer the doctor gives to me, give my mother to appreciate the God. So that's why I said let me call back again.
And I want to reiterate that the doctor said he should go back to the hospital.
Yes, I heard what he said.
All right. Clear, so thank you very much, Julia Dana.
I appreciate it.
0814-335-9. Yes, good morning.
My name is Ibrahim Akura, a regional professor from Vancouver, Tiabu, local government.
Thank you for joining us.
My regards to your guest in the studio.
Thank you, Baima.
Thank you very much, Baima.
That is a question. I want to ask here that between young, elderly, and pregnant woman, who is vulnerable to getting these particular diseases, and in the course of discussion, They just told us that there's a vaccination only for children. Why is this so? And last but not the least, how far about those that are in the IDP camp about this particular disease so that they will be treated? Is it free or not? That's my question that I want to be clarified. Thank you.
All right, thank you very much, Ibayima. So stay tuned and listen to the answers. All right, he asked 3 questions. And number 1, that between children, pregnant women, and adults who are most vulnerable to be infected by tuberculosis. So, Dr. Abba, you would want to respond to him quickly.
Okay. The children, they are born with very low immunity. That is a passive immunity that they will get from the mother. So that is why they need to be vaccinated immediately because they are vulnerable. And also, before even children, sometimes when you see underweight child, those ones are probably the parents have not, where the mother was not properly fed during the pregnancy time. They can give birth to children that are underweight. You know, even when the child is so much underweight like that, I think before it's vaccinated, they may have to delay it because that low weight itself, it's a problem. Because we have seen cases of some children that were vaccinated with BCG like that, and after some time they even develop active TB because of the very low immunity that they have as a result of poor nutrition of the mother during the gestation. So children actually are vulnerable. Adults, they have developed immunity, so they are less vulnerable, but they are vulnerable because as they are exposed to the bacillus through the dust they breathe in from time to time, they are at risk. And then the elderly too, you know, as one ages, their metabolic rate is reduced. They eat less. And what you eat, especially the proteinous food that you eat, helps you to build your immunity. And so elderly as well as children are more vulnerable than the adults, the young, the people that are in their heydays. So the elderly are equally vulnerable. They are at risk and they need to be protected. So there's this need for probably for you to check also the potency of the vaccine. You know, this vaccine we are talking about, they are heat labile. They can denature very easily. So if they are not properly stored, like in a solar-powered freezers, they are not properly stored there, or they are moved, and when they are administered, they will not help. They will not protect the intended person again. So to answer his question, children, elderly are more at risk, are more vulnerable than the adults. Thank you.
All right, Dr. Anza, I'd like you to respond. He says, why is there no vaccination for adults and only children?
Well, medical science is a constantly evolving field, and there are vaccines for some diseases. There are no vaccines for others yet. Research handling containing tuberculosis will be the development of a suitable vaccine for the adults. At the moment, it doesn't exist. Tuberculosis infection. That means they have been exposed to this bacteria. They have it in their body, but because their immune system is strong, is competent, it has been able to suppress that bacteria and prevent it from developing into a disease. So what happens now removed, the bacteria becomes active and converts into active tuberculosis. So like he said, individuals who are immunocompromised, there are conditions like old age, elderly, people who are elderly, their immune function wears out. They are at a higher risk. Children, because their immune system is still developing, it's not yet mature, at a higher risk. And then pregnancy is also a state of immunosuppression. So it also predisposes this individual. They are at a higher risk. But basically, because we have latent TB in most of us, we are basically at risk of developing active tuberculosis whenever our immune system is compromised.
Okay, let's take another call. Hello, good morning.
Hello, good morning.
Yes, what's your name and location?
Yes, my name is Vincent Ako. I'm calling from Wadata.
All right, Vincent, go ahead.
Yeah, my regards to the doctors in the studio.
Thank you, Vincent.
Yeah, I want to ask, why is it that TB treatment takes longer time than other kind of coughs that we have?
Okay, the doctors are here to respond to you, so just stay tuned and listen to them.
Thank you very much.
All right, we have text messages here. I would like to quickly take them so that we'll continue. This one says, good morning, Mr. Fannin and your guest in the studio. They have spoken elaborately, very well concerning TB in Nigeria. My advice to both federal and state governments is that they should put more funds in handling TB, and also the welfare of its personnel should be well taken care of. And this is Comrade Kanti Michael from Gado Villa. Thank you very much, Comrade Kanti from Gado Villa. And then this one says, good morning, presenter and Dr. Abba in the studio. For me, I really appreciate the doctor for throwing us light about TB. My only question is, what are the preventions of TB? I am Jonah Benjamin from Nakagwe West Local Government Area. I think we talked about that. Okay.
Yes, we did.
My appreciation to Agate Radio and your guests for the awareness and education. I think it's been so far so well. Okay, with TB management in Nigeria, but alarm bells have been rung. Our leaders and policy planners must rise up to the challenge of the exit of a major donor in the fight against TB. That was the US aid. I believe with the necessary political will, this gap can be conveniently filled, and the time to start acting is now. He emphasized that, writing it in capital letters. Okay, Stitch in Times from Honor Occupier Extension Makudi. Thank you very much for your contribution, Gabriel Onyilo. All right, this one says, I am Prof. Francis Nguto from Tiamo. I gave ready you too much. Okay, thank you. You are too much too. All right, so that is it. Let me take another call so that we. Hello.
Hello.
Yes. Good morning.
Morning, sir.
Yes. What's your name and location?
Yeah, I'm Moses Anum. I'm calling from Anum Village in Makodi.
All right, Moses Anum. Go ahead.
Yeah, my greeting to the guest in the studio.
Thank you very much, Moses.
Yes, I don't know. I joined the program a little late. So I don't know whether doctor, maybe you already said it, but I'm confused. Yeah, my is a question. Can a patient TB and who's he's already on drugs and he also have HIV/AIDS and he's taking the drugs at the same time, or how? I don't understand it. Yeah.
All right. So stay tuned. Doctor will respond to you.
It's okay. Welcome.
All right, so doctor, can someone who is on TB medication also combine that with his or her HIV treatment? Dr. Anza?
Yes, thank you very much. It's a very important question, and that's what we do. However, if both tuberculosis and HIV are diagnosed at the same time, if both tuberculosis and HIV are diagnosed at the same time, the individual is commenced on TB treatment first for 2 weeks. Yes, then 2 weeks into their treatment of tuberculosis, they can commence HIV medications. But afterwards, they can take the drugs at the same time.
All right, so we also want to look at another issue, which is that of drug-resistant tuberculosis, and what are the implications for public health. I like Dr. Abba to respond to these, the issue of drug-resistant when it comes to tuberculosis.
Okay, thank you very much. Drug resistance is one when the medicine have been effective in the treatment of tuberculosis or any other disease suddenly becomes ineffective. You are using the same drug, but it's not giving you the desired effect. And many things are responsible for that. Number one is non-compliance. You see, when a TB drug is prescribed by a doctor to a patient, they will tell you, take this so number of tablets at this time for this number of times for this period. And some people, when they start taking this medicine, and because it's very, very effective, they start seeing a improvement in their health. They become strong, the cough is stopping, they are gaining weight, and they say, okay, I'm all right now. They'll discontinue the drug. When you discontinue the treatment, the organism that is already weakened, about to die, wakes up and becomes stronger. And then the medicine, where you go back again using the same medicine, it will not work again because it has formed resistance against that medication. And another cause is when people use drugs that are substandard. They use drugs, in our society today, if not because of the one that they are giving to us from Europe and Germany. If you are going to rely on the one they buy from the market, some of them, the quantity they put, the concentration of some of those tablets are very, very low. They might write 500 milligram on it, but what is in it may just be maybe 100 milligram or less. So when you use these substandard drugs in treating TB, it will not give you the desired effect. And because it's not potent enough, the organism will form resistance. And again, the storage of these medicines, the medicines are supposed to be stored at good temperature that is not maybe why being displayed in the ambient temperature, not give the desired effect. So the organism has formed resistance, and then it will not work again. Definitely the solution is I have to change that line of drug. The doctor will definitely speak more on that. The first line of drug, which is rifampicin and isoniazid, if it's being used and it's not working again, you have to do a test. The test will tell you the next line of drug to use. So there is culture test, it's sputum culture. It's not done in everywhere. It is done where you have the facility, where you have the level of security. If not, you do culture in some centers, you are causing more problem because you expose the bacillus to the atmosphere. And multi-drug resistant, you have the extensively drug resistance and all kind of things. So it is good that when drugs are prescribed by a doctor, take it for the period. If it's 3 months, take it for 3 months. It's 6 months, take it for 6 months. Don't take it for a period and then you say, oh, this drug, why I'm taking it is giving me trouble. It's giving me headache. I'm reacting and all that, and then you stop. You are now allowing the bacterium that causes this tuberculosis to form resistance and cause more trouble for you. Far more difficult to treat, far more expensive to treat, but they are treatable if they stick to the prescription. Thank you.
All right, Dr. Anza. So Dr. Abba raised the issues. So one would be wondering, one who is in this kind of situation would be wondering, is there any hope for me at all now that my system is resisting the drug that should.
Is far more difficult to treat than drug susceptible tuberculosis. However, it is treatable and curable. There is testing for resistance. The gene expert that is done also tests for resistance, tests for rifampicin resistance, and right from the point of diagnosis, if it is gene expert that was done, it also tests for resistance, so that the individual ab initio is not started on first line of TB medications, that he may, if they are resistant to those medications. Now, resistance develops through a number of ways, most of which he mentioned, but also resistance can develop. Somebody can have resistance if the variant of the TB that they contracted was drug resistant ab initio. There are two ways I want to talk about this. Somebody can have drug susceptible tuberculosis. That means this tuberculosis is responsive to treatment. But because they did not follow through the treatment regimen successfully, they did not adhere to the treatment regimen, the tuberculosis is exposed to suboptimal concentrations of the medications. So they have access to this drug, they study it, they adapt to it. That is how they develop the resistance. They develop coping mechanisms. And so they now begin to cope with this medication. So when you now even step up the dosages, they have developed coping mechanisms. So they successfully outlive the concentration of this medication. So they are able to continue. Now, this is the individual who has developed that resistance. They have developed that resistance in themselves. But as they transmit the tuberculosis now, the bacteria to other people, they now transmit the one that is resistant.
Forms,
yes, they transmit the resistant one. So somebody who now contracts this disease, it doesn't even have a chance to develop their own resistance. They have initially receiving the drug resistant tuberculosis, So it becomes a really difficult situation. So we really want to emphasize that people should really, really adhere to treatment, because just imagine one contact develops drug-resistant tuberculosis and transmits the resistant strain, to the community. It becomes really, really problematic. Really problematic.
That's true.
But there is hope for that, for people who have drug-resistant tuberculosis, either the one they develop themselves or they contracted it from other people. If they present to a healthcare facility, the drug resistance will be tested for drug resistance, and if it's resistant, they will be treated. There are second line of the drugs they are resistant to, and then they will be treated accordingly. But of course, it's more difficult, it's more tortuous. The process is more demanding.
Thank you very much. So now we want to look at, we've been saying government. So we want to look at, community-based initiatives to address tuberculosis epidemic in our various communities. So Dr. Abba, he would like to walk us through what can community members do, or maybe traditional leaders, religious leaders, maybe opinion leaders generally. What role can they play in ensuring that tuberculosis is reduced to the barest minimum?
Thank you very much for that question. Like we're talking about awareness that time. Awareness go a long way. In our town hall meetings, the need for awareness is also there. Gathering meetings and all kind of things. People need to be informed about tuberculosis, both susceptible and drug resistant, and the way they can come out of it. We thank God the primary health care are already built, they are built and they are there in the community. So there is need for people to please always go there. Once you start coughing, you start seeing the symptoms of tuberculosis, go to the clinic and report yourself. And another aspect, community engagement is really key. And when you look around and you see somebody that is having this problem, encourage the person to go to the hospital, to go to the clinic. And also, I think there was this digital device offline digital device that they made available sometime for reporting. If you see a case, and it helps case finding a lot. If you see a case of TB in anybody near you or in your family or in the community, you can report it. You can report it so that it will be investigated and treated. So in our churches, as we go to church, our spiritual leaders, as they preach the gospel, they preach their sermons, they can take 1 minute or two to talk about tuberculosis to the people, to the worshippers that come around. You can also invite a healthcare professional to the church, to the mosque, to talk to people about their health, and to talk particularly about tuberculosis, because tuberculosis, like I said before, every one of us is vulnerable. As far as you can breathe in oxygen, you are vulnerable to TB infection. So it is very, very important that in whatever meeting that we find ourselves, let's talk about tuberculosis. Let's talk about the provision that have been made for it, the clinics, the drugs that are free, the treatment, the diagnosis, everything is free. All that is required of you is to present yourself. Present yourself to the health center, to the community, and then they will take care of you and you'll be well. Let's not hide tuberculosis. Let's expose it as much as we can. Commit, because the theme for this year says we can end TB. Commit, what's the other one? Invest and deliver. So if all of us are committed to ending the TB, we can end it. Don't hide it. Anywhere you find it, report it. Report it to the health facilities, report it to the government, and TB will end.
Okay.
Thank you.
All right. We did a report yesterday. I started talking about this. We did a report yesterday where we spoke with the program manager for state tuberculosis, leprosy, and Brulai ulcer control. Thank you very much, Dr. Brulai ulcer control. And then he said that tuberculosis treatment in the statewide, is free of charge.
Yes.
That's what he said. All right. So now, Dr. Anza, I want to ask you, are there key policy changes you would expect, as it concerns the treatment for tuberculosis in our communities, for our people?
Well, I don't think, from my point of view, what I'm looking at is it's not any specific change in policy. I think what we need to do is what we need to do is to increase, to raise the tempo of what we are already doing, case finding, already from the point of view of policy making. Once a case is identified, it's able to be diagnosed, treated, and cured. So basically the infrastructure and the system is there in place to handle this condition. What we need to do is also reduces the number of people who are exposed to the risk of contracting tuberculosis infection. And like you were saying, we need to take it to the grassroots. It needs to penetrate the grassroots. One of the ways, again, that I would suggest is through posters. We can paste posters in the local dialects in the marketplaces, places where people gather, marketplaces, at the town halls, in religious gatherings, and these posters are there. Also, we can increase awareness by engaging the gatekeepers in the community. They are the youth leaders of market unions, organize an awareness step down what they have learned. So by this mechanism, the awareness will seep down to the grassroots, because if you talk about, if you engage the Okada Riders Union, for instance, they would do that to their people, and these people have families and so on. So it cascades down all the way to the lowest ladder of social organization. And if you do that, once individuals have high index of suspicion and the myths are taken care of, they will identify cases and increase the yield. The yield in terms of diagnosis will increase, And with increased diagnosis, there will be increased uptake of treatment, increased cure, and then we'll be able to reduce both the incidence and the prevalence of the condition. So I think in terms of policy, we are doing the right thing, but we need to increase the scope of the coverage of
the program. Or if there's anything I have not asked you that you wish to say.
Okay, thank you very much. I want to thank you, Get Radio, for providing this platform for us to educate the populace about tuberculosis. I think we have made it clear that tuberculosis, everyone is vulnerable. Anyone that breathes in oxygen is vulnerable, no matter highly placed. And also tuberculosis is treatable, it is curable. To form a little more of a hygienic habit, if you have cough, don't be throwing sputum everywhere. Carry your hanky with you. Cough into your hanky and cover it. Or you have tissue paper, cough into it, go and put it in a dustbin somewhere. Don't expose the spittle, don't spit everywhere. Environment, try to use your hanky to cover your nose. If you have a face mask, use it. Don't say that God is in control. God will take care of me. Yeah, God has given you wisdom also to take care of yourself.
Okay.
And if there is any case, please quickly go to the hospital. Don't ascribe it to attacks from the village or anywhere. People who are hating you.
People should develop the habit of seeking health care, timely health care. And we need to understand that people who have tuberculosis are people like us. They are not some group of people that we need to try to imagine where we can find them. They are living in our family houses. They are colleagues at work. So let's increase the index of suspicion and seek timely health care whenever we have symptoms. Thank you.
All right, thank you very much. The Benue State Chairman, Association of Medical Laboratory Scientists of Nigeria, Dr. Paul Abba. Thank you for your thoughts on the program.
You're welcome, sir.
And I'd like to appreciate you very much, Resident Doctor, Department of Epidemiology and Community Health, Benue State University Teaching Hospital, Makudi, Dr. Msona Anza.
Thank you very much for inviting me.
And I'd like to appreciate everyone who called and everyone who listened. That's our program for today. Do join us on Wednesday for another edition. My name is Fanen Kouanum. Good morning.
Inspirational music. We are Agate Radio 95.5.